Good afternoon, everybody. I see some folks are hopping on a bit early. We're going to give it a few minutes after 1 o'clock, just after 1 o'clock, let everybody else join us, and we will get started here soon. Thank you. Good afternoon, everybody. We're going to get started here in just a few minutes. I'm going to give a few minutes for some other participants to join us. We had about 30 people register, so let me just give them a few more minutes to join us. All right, good afternoon, everybody, and welcome to the User First webinar for this afternoon. We're going to be talking about providing the essential online services for persons with disabilities while complying with ADA and international guidelines. I'd like to take a moment to wish everybody, you and your families, all the best during this time while we're all in social distancing and stay-home orders. I hope if you have any family members as well that are serving on those front lines as our healthcare providers, that they are safe and well as in addition to that. And just like many of you, we are also, my colleague Sean and I are working from home. So we'll do our best to mitigate any background sound, but please excuse any unusual sounds, animals, kids, or anything that might interject. But I know everybody is working under those same conditions. So welcome this afternoon, and we will go ahead and get started. I am Reagan Bartlow, the Vice President of Communications, and I'll be presenting with my colleague, Vice President of User First, Sean Pike. And we're excited to have you all here today. Just a few housekeeping items. If you will, closed caption is available as an option, and this webinar is being recorded. So if at any time you have to hop off early, if something happens, we will be posting it later online to our YouTube and to our website. As we go along, you can add questions in the chat box, but we'll get to those questions at the end. And at the end of the presentation, I will open up the Q&A window for you to submit questions there. If you're having any issues with the Q&A window, please email me at reagan.bartlow@userfirst.com. And you can also, if you're having any sound problems, you can join us by phone. There are the US and Canadian numbers if you need them. So today's agenda, we're going to be talking about the changed online environment. We all know it has drastically changed. We're going to talk about how capturing more users through digital accessibility can help you maximize your reach and your services, and it also helps you maximize your revenue. And you can also care for those users by providing the user experience, a better user experience, and increasing your brand loyalty, because there's no more loyal online user than persons with disabilities. And then we're also going to talk about how, while you're improving your service and looking at complying with those guidelines, how you can reduce your risk of litigation, because there is that risk out there. So let's talk a little bit about digital accessibility. It's often really misunderstood or not understood at all on several levels. There's a massive knowledge gap out there and a lot of misinformation as well. For example, we often get questions or comments such as, this is just a compliance thing. It doesn't really increase the bottom line to my business. And while compliance is certainly a concern, there are business benefits to making your assets available. And speaking of the compliance perspective, we also receive questions like, where in ADA can I find the specifications for how to make my website and other digital assets accessible? And Sean will get into that a little bit later. Some people actually have a very negative view of accessibility. They might say things like, I know what web accessibility is, it's alt tags and it's tedious and time consuming. And then others also have just a more narrow view of not understanding who's using their site. They may not think that people with visual impairments are using their site. And this doesn't actually account for disabilities such as motor skills or cognitive challenges that your users might also be having. So simply stated, digital accessibility ensures that all users, including those with varied abilities and disabilities, can use your website, your app, and other digital assets so they have equal access to your goods, your services, your information. Your digital assets should be able to accommodate people with visual, auditory, motor, or cognitive impairments. So let's talk about the new normal, if you will, of the online atmosphere due to the coronavirus. And no shock here, the internet use has rapidly gone up. And this chart shows a shift in users' focus online. You can see a trend toward essential and not essential services. example, like non-essential services, entertainment services. So people are going to go away from that. Obviously, the biggest bubbles here are in the e-commerce and a mix between like groceries, supermarkets, things like that. And we also know we have a few of you on the line from educational services, and we're going to talk about the education aspect as well from K-12 as well as college education. So diving a little deeper into online use statistics, here are a variety of activities that persons with disabilities need access to. And these essential services have become mainstream online. And while we were already seeing increased trends of online use, for example, in telehealth, we were seeing an increased use already. The COVID pandemic has accelerated the use in many of these areas. Telehealth was thought of as novel and convenient. You might be getting something in your mailbox about, use teledoctor. You can have a meeting with your doctor online, right? Now telehealth visits have surged 50%. And Teladoc has reported a spike in video requests of more than 15,000 per day. So, I mean, that's pretty substantial. And then when you look at e-commerce, the sales have jumped 25% in just since March. And it's largely driven by the doubling of online daily grocery sales. And if you look at the number of households, that's 39.5 million households are ordering their groceries online. That's a 145% jump since August of 2019. If we take a look at mortgage loans, because forbearance has become a big issue, literally 1,000% increase in the rise of mortgage forbearance in just 1 month. And if you can imagine that you have a visual or mobile impairment and you're trying to use a screen reader, or you're trying to use keyboard navigation while competing with all these folks online. And that's what's going on for people who may have those kinds of disabilities. And when you consider that 20% of our population may have a disability and a need for digital accessibility, you can see that they might have some substantial barriers to navigating this atmosphere. So while making digital environments accessible allows customers to navigate websites and apps, to shop and use services, and residents to actively participate in their community. Now, if we take into consideration the number of public schools, 124,000 schools have closed out of the 132,000, and that's 55 million students. 7.5 million of those students have special needs. So imagine that your kids have special needs and they're trying to get on sites, and the site has what we call a blocker. A blocker means that they can't move beyond without some sort of assistance. They can't click on something, their screen reader can't read something. And now that special needs student may need additional assistance from their parents. And I have kids that are in public school, and we're trying to help them be online while we're trying to work. So you can see how this issue can really compound if sites aren't accessible. And we know the public education system is trying to catch up with this. So, but let's also take a look at our college education system, because they too, the shift to online learning has been steadily increasing over the past 14 years. But now with more than 250 colleges and universities closed, the need for accessibility online has greatly accelerated. Students need to have more access than just classes. They need libraries and other services. And again, about 20% of students have a disability. So, and there are some resources here for you. The National Center for College Students with Disabilities, Accessible College, and National Federation for the Blind all have resources that can help colleges navigate and provide information that they might need. So keep in mind that our public institutions, though supported by state and federal funds, they also fall under Section 504, the Rehabilitation Act of 1973, which provides equal access for students with disabilities. And Sean's going to dive into that in just a bit later. So now that we've explored this new normal and we can see the buying, the education and social atmosphere of what's going on, I'm going to shift things over to my colleague, Sean, and he's going to discuss how you can capture and serve more of these users and customers while maximizing your reach and revenue and improving your user experience. Sean?
Reagan, thanks so much. And I appreciate everyone being on with us today, and hope everyone's certainly safe, healthy, and hopefully in good spirits. So one of the top issues that really gets ignored with talking about web accessibility, because compliance comes up so much, which I will talk about in a little bit here, is really the upside that comes from delivering web accessibility to your digital platforms, whether you're talking about your website or your app. Whether you are actually in the business of e-commerce or you're in the business of education, or doing something as a nonprofit and just looking to attract more people to your cause for participation and donations and things of that nature. So when you look at some of these stats, they're really astounding, really from a perspective of the population you can bring into your fold, so to say. So 1 in 5 US adults, or 64 million people, have a disability. It's important to understand that the last census taken was 2010. We do the census every 10 years. It's pretty much the same time period ancient Rome did their census, but 10 years is a long time. And we're an aging population. So those stats, if they haven't gone up, it's, well, if I was a betting man, they'd be going up, and we won't find out probably for a little while, because I think the census is going to be delayed. But the point is, you have a large market out there where if they don't have access, or you're not demonstrating that you are providing access, you will not be able to capture them and capture all their goodwill, capture their business, all the things you're looking to do online. Now you move to most businesses right now during COVID, and online is everything. So of course you want to optimize that to the greatest extent possible, leaving out this population, leaving out their social networks of people that'll buy, because you're doing, you're serving these people they know, will also be beneficial. Next slide, please, Reagan. So this kind of brings the numbers into the fold even more as far as revenue numbers. If you go to most corporate marketing shops, even small, medium business marketing shops, even in education, it's always talked about with capture and target. How do you target? Who do you target? Age ranges, demographics, etc. Data is sliced and diced to the extent, and the end result, of course, is to quote unquote capture that customer, capture students interested in going to your college, etc. When you look at some of these stats as far as disposable income and discretionary income of persons with disabilities that was done by the American Institutes for Research, it dwarfs a lot of other demographic groups that right now, people are focusing on more so than people with disabilities. And people with disabilities, of course, cuts across all demographics, right? Much like COVID, it doesn't discriminate. Having a disability, which of course these days is more likely given advances of medical technology. So these numbers really matter, and they can really help your business grow. They can provide great assets in your corporate social responsibility strategy, and whether you are an organization that's for-profit or not-for-profit. Next slide, please, Reagan. So the big one, of course, we left for one of the last things we talk about here. Everyone has a lot of questions about compliance, litigation risk, and trying to understand what's going on. We keep a close eye on it, even on a daily basis, to see what's happening in that space, so I can speak to it as we go along here. Next slide. So majority of lawsuits, and these aren't all lawsuits, because lawsuits really, thanks to our federal system, they come through a number of different avenues. They're reported a number of different ways. A great blog, Seyfarth and Shaw, that's really the definitive blog on accessibility cases, both web and other, aggregate that information and do a good job culling through that data. Excuse me. You can see here what 2019 looked like. A majority of them fell in certain states and jurisdictions, you can see. But other states were certainly not absent from receiving lawsuits out of the ones that Seyfarth and Shaw analyzed at various levels here. And really, Seyfarth and Shaw analyzes at the federal level in most cases. So the numbers are a lot higher when you go to state and local entities and you go into a lot of other lawsuits. So it's important to note that. Next slide, please. So here are the digital accessibility lawsuits filed in 2020 prior to COVID-19. One of the questions I always get is, have they changed, since COVID started? They slowed down initially, and now they're picking back up again, even in the past few days, which is interesting to see. Basically, there's nothing to keep people from filing these lawsuits as they encounter these problems. And as more persons with disabilities try to get access to essential services and non-essential services via the internet at the level they are going to with COVID, that's going to continue to happen. So they've started to go back up. Courts obviously are not in session and hearing them from that perspective, but there is quite a backlog that's building. Again, even over the past few days, we see a lot come out on a daily basis where there's concerns about some of these lawsuits. The important thing to kind of remember when looking at this, depending on how I kind of get the question in a kind of politically correct type of way sometimes of, okay, so how do I stay out of trouble? Am I really going to get trouble? Am I really going to get caught type of thing? Can I go 75 miles an hour into 65 and be okay? Those types of questions I get. And what seems to be happening here is they're going to continue to increase. They're not going to go down, and it's going to continue to come to a head as an issue going forward. Certainly during COVID, it appears now, and certainly after as well. So it's important to at least have a plan and get ahead of some of this would be my first recommendation. There are a number of ways to do that I'll go into. Next slide, please, Reagan. So without going into all the various acts you have to look at, what I would like to tell you about compliance and when thinking about compliance is everything revolves around your organization and certain dynamics of your compliance risk, right? There are a ton of them that come into play, certainly from the legal perspective. From the civil rights laws that come into place. There are some overarching ones like the American for Disabilities Act, but then there's breakdowns depending on the organization you are. And then there's all sorts of other additional regulations if you fall in certain industries. On top of all that, you have to look at other factors like your actual level of technical accessibility itself, your exposure, how much traffic your website or web app receives. And you have to look at geographic factors as into where you're located, et cetera, when you're looking to really assess your risk. Although ADA is the law of the land and provides that kind of baseline, you really have to kind of look at some of these dimensions when you're looking at putting together a web accessibility compliance program to make sure that you're covering what matters to your organization depending on who you are. So that's very important to remember. This is just a list of some of those that might go into your various compliance concerns with web accessibility. You would hate to do one and then realize that there's a state accessibility law that's a lot stricter, and you've made kind of a wrong calculation in there. It's important to get that baseline when you're looking at your compliance as an organization. Next slide, please, Reagan. Okay, so I mentioned some things about technical accessibility here, and obviously that seems to be the most important facet, because even after you have a plan, which you should, the question, of course, is how do you fix these things? There is a easy answer, but there's a lot of complication and nuance technically about how things are fixed. Really, what I can tell you is that the only standard that matters to follow in terms of fixing is the Web Content Accessibility Guidelines. There are various levels of quote unquote WCAG, which is the term used in the industry, that have different meanings to them. Reagan talked a lot initially about some of the confusions with digital accessibility. There are important overlaps between compliance and the technical accessibility of your website that come into play. For instance, many of the lawsuits filed are from visual impairments. So if you technically address visual impairments, you can do a better job at keeping yourself technically compliant. There are some examples I can go through in all four of these. I will tell you that I will go through really one example from a real empathy perspective. If you're new to web accessibility, you're trying to understand how the experience can be from the perspective of a person with a disability. If you have a motor disability or if you are visually impaired, you may not use a mouse. After all, a mouse is a precision instrument. In that case, you may use a keyboard. You would use Tab, Shift, Return, and arrow keys to navigate websites. So if you want to kind of do a little exercise to see what it's like, go on your website and hit the Tab key and space, arrow, return, and try and navigate your website. And you might see kind of the experience, the difficulty, and in many cases, the impossibility of getting to certain things on your website as if they are not even there. You can find these guidelines online. They are the framework for delivering accessibility, and they are really what you want to follow when looking at assessing and fixing your site. Next slide, please, Reagan. So speaking of testing and fixing your site, you should, from a technical perspective, look at establishing some sort of baseline. You should run some tests. There are automated tools that run tests on your website. Some are free, they're limited as far as what they do, but they're free. And then you can find enterprise grade tools as well. User First has one, other vendors have them as well, to do some automation. The limit with automation in fixing accessibility barriers is well known around the industry, and there's nothing out there that has solved that problem in the case of artificial intelligence or the like, because of what we call contextual errors that require someone to manually inspect and use an assistive technology like a screen reader to validate that accessibility barrier. So the machines only bring us so far. This is reiterated by the federal government and again, industry-wide. But it's a good idea to get a baseline as to where you're at, to know kind of your level of accessibility, whether it's holistically from auditing every element on your website, or whether it's from running a scan and getting a sense of direction. At the end of the day, you want to have a good basis for kind of going forward on your next decision point. Remediation, the process of actually fixing accessibility errors, can really be done in one of two ways. It can be done at the code level, right, with developers at the source code level, where developers would go in if you own the website. Or if you're relying on a third-party vendor, it would have to be the third-party vendor, and they would have to make code changes, test with manual assistive technologies like screen readers, and confirm fixes through that process. There are cloud delivery remediation platforms that vary highly in capability. User First has one. There are other vendors out there that have them as well that address accessibility errors. What you have to keep in mind when you look at actually fixing then is your compliance baseline that I mentioned before. Again, keeping in mind that if some errors aren't fixed and those are the ones from which the lawsuits are coming, and you fix other ones, you haven't really fixed your compliance issue, so to say. You're still exposed. So you have to tread carefully and ask a lot of questions. Continuous testing and monitoring is also what has to be done as you make changes to the site. Not necessarily, although in some cases minimal content changes, but you do have to look at certainly major structural changes as well to address any accessibility barriers. The good news is hopefully with most platforms, it'll get better as time goes on. Next slide, please. I'm just going to highlight a few of the things you should address here, and you can look through. You can ask questions in the Q&A about things specifically. With websites, as with a number of other things, you have to consider your policy. The Principle of Universal Design and WCAG 2.1 standards is a good place to start technically in considering how you actually implement it. You have to think through things like quality assurance and what you do to maintain accessibility on that end as well. Solutions to address those, you can do audits, as I mentioned before, source code or automated remediation with a third-party plugin, accessibility as a service. And of course, there's training involved if you have a development team and you want to get them up to speed, and that's a good way to go as well. Next slide, please. Native mobile apps are starting to become more and more part of lawsuits that we're seeing out there. Mostly it's still websites from a compliance perspective, but native mobile apps, you have to address the actual code of the native mobile app because they're a little trickier than websites as far as technically getting access to or being able to do anything at the HTML layer. So they are more advanced technically. But again, your policy should cover it in a certain way. If you have a policy that is addressing your website and addressing some things on native mobile apps over time, that can be a pretty good policy, depending on kind of how it's implemented and what you're doing to get there. It's not kind of a one and done thing. It's often a journey. Next slide, please, Regan. And that brings us to the end. I know it's a lot of information. It's really interesting seeing what is happening with COVID-19 and the mainstreaming of pretty much every aspect of our lives online. And I think web accessibility has come into light as far as some very important questions, certainly in compliance, the moral imperative, number one, and also your ability to provide good customer service and service to those individuals that may need it. So Regan, I'm going to turn it back to you.
Yes, thank you, Sean, and that was really informative. I'm going to open up the Q&A section, and Sean, while you were talking, we did have one question coming from Laura, and she's asking, are the lawsuits that have been filed, so the ones from 2019, have they all been settled versus filed? I think a good way to address this, Sean, would also be talk about, you know, how long it takes to settle some of these suits.
Yeah, you know, and I will start with the disclaimer. I am not a lawyer. We have an in-house counsel that does a very good job elaborating on some of these, and I'm kind of echoing some of his points, though not verbatim in this. But basically, the lawsuits tend to. It's interesting. The lawsuits tend to go on quite a while in some cases. There's a period where where injunctive relief is permitted. Some of them are settled out of court. You know, in those cases, who knows what happened in some cases, you know, in order to address it. But even in those cases, with some of them settled out of court, there are repeat lawsuits on the same website in some cases. So if nothing was addressed and you kind of settle out of court and get another lawsuit because you're at the same level of accessibility you've been, that's a bad situation that we've seen some people be in, certainly. But there are a decent to large amount of settlements out of court. They can go on for a long time, and some people kind of we get calls where some people are coming up on a period where they have to do something where they kind of brush the issue to the side and realize that they didn't make enough progress or any progress, and they kind of call us in a panic, which also makes for interesting conversations. But I hope that addressed the question okay.
Well, I believe one case that we could talk about, like the Beyonce case, it's still out there. The case settlement is still pending. Beyonce got sued for an inaccessible key features on Beyonce.com. And so that case is still going on. We've seen some cases, the city of Denver, when it finally settled, was up to $3 million. So, and then Winn-Dixie is still in appeals court from what we know, from what we can find online, the public information, and they were at $100,000 settlement. So they can go on for months, your court fees can go up. And I know the other thing that we're saying is while under ADA, the plaintiff can't get damages, they can, in state laws, they can get more damages, which is where we start to see the overlap of laws that Sean was addressing. So it might be a ADA Title II plus the New York state law, right, discrimination. So we've seen it layer up too. So that can cause complications for businesses, colleges, anybody that has a suit filed against them, right, Sean?
Yeah, and Beyonce offers a cautionary tale actually, because if you ran an automated scanner, we have an enterprise grade scanner here tool at User First that some of our customers use, and we actually scan the site after too. The scores came out really good. The problem was per the specification, at a really maximum level, only about 40% of errors are able to be detected automatically. The plaintiff in that case was someone, a fan of Beyonce's, trying to buy stuff on her online store and was using a screen reader, was visually impaired. So even though, you run a scan over it and it looks really good from that perspective, because nothing manual was done to address the other 60% or so of the specification, they got hurt on that one. So it was kind of interesting from that perspective.
Sean, I know one question that we've gotten a few times, whether it was from a reporter or whether it was from a customer, and it came up in the Domino's case, is providing a alternative way of communication, i.e. Domino's provided a phone number. Is that acceptable, and does that protect businesses, universities, anyone from not from lawsuit? Anybody can sue you from anything, but is that enough for accessibility? Is that question we get quite often?
Not necessarily is the answer to that. Obviously, it's dependent case by case, and in the case of Domino's, the determination was that it was not an equal service in that matter. So it becomes that some of the arguments around that, depending on case to case, can be, being able to order in a kind of easy, gooey WYSIWYG online is much different, much more convenient, a different level of service than having to kind of call in and wait on the phone. So it really depends case to case, but certainly you don't want to necessarily account that as being the ruling. It'll really have a lot of dependencies in court, but to answer your question, not necessarily, Reagan, and it brings up a good point, because a lot of everything essential keeps moving online. The internet, there's kind of, and this is my last point on it, there's a philosophical argument as to whether the internet is like a utility. It's kind of hard to argue against it, all kind of arguments aside prior COVID to with COVID now. Is the internet and access on the internet really an essential service defined by things in other laws like the Stafford Act of 1988, which was amended in 2016 and talked a lot about emergency situations like the one we're in now. And the arguments people are making is that, yes, it is a utility, and in this case, they're certainly being proven right, in my opinion.
And I'm just going to come up with some questions that I have ready for us. But everybody, please feel free to type your questions in, either in the chat room or I've opened up the Q&A box. Sean, we do have a few colleges and universities on the line today, so I thought you might address that overlaying of compliance, because if they receive federal assistance funds,
yep,
there's some more prescription there, is there not?
Yeah, colleges and universities have certainly a unique challenge in a few ways. The Department of Education, in coordination with the Justice Department, has its own enforcement mechanism for universities and colleges and kind of addressing web accessibility. Number one. Number two, university websites tend to be very big because so much content is being created. And what that essentially means is, whereas a smaller medium-sized business might have about 3,000 to 4,000 index pages on Google. That is one of the best sources for seeing kind of the size of a site of what Google has indexed in its search engine. Colleges can go into the hundreds of thousands of pages. So it's very important with a web accessibility strategy with colleges to understand their requirements, but really do some hard planning on prioritization and what they can tackle, how they tackle it with the resources they have. If you look at critical things in your plan that you would probably want to address first, it would certainly be recruiting and making sure that people go on certain sites, that certain parts of your site can get information they need if they want to attend the college, right? And also make sure, obviously, that the most traffic parts of the website have some sort of plan to address them, and also what is the fallback plan for the less traffic parts of the website. So it's complicated both technically. There's a little more pressure on the end of compliance as well for universities and colleges, but that kind of becomes the responsibility of the education institutions, and kind of comes with the territory of getting the federal funding kind of privileges that they receive. So
Okay.
I hope
We've had a couple questions pop up, so I'm going to take one first. I'm going to take them in order that we received them. And this is a good one. Is Zoom more accessible than other online meeting software like Microsoft Teams or Google Meet or GoToWebinar? And I'm going to start out with this. I'm going to let Sean finish it. It's funny, we use both Zoom and Microsoft Teams in our office. From a Zoom aspect, we actually, and we're going to thank our closed caption service. We did have to hire outside to do a closed caption service to make this a little more accessible to people who were hearing impaired. But I'm going to let Sean address that because I think you've looked at a few of these, Sean.
Yeah, and without kind of picking them out too much, some are, they've all made efforts to deliver some sort of accessibility with different levels of automation into each of them. I guess I do have to give one shout out to keep it positive, that Microsoft has actually done a very good job in delivering accessibility and making it a priority. There are a lot of reasons for that, that they do that. There was a story of Bill Gates answering a post on Reddit directly when someone asked about providing accessibility, saying that he was going to address it. And obviously, you can imagine the shock on the other end of the computer when someone got a response back to their question or frustration about accessibility with a Microsoft product and got Bill Gates to answer them. But that gives you an idea of how seriously they take it. So I would give them that shout out. I would say that there's variability in kind of the frameworks and accessibility of some of them, but they have all made attempts at addressing it, and some more so than others.
So we have a question that, Sean, we have been discussing a lot these days, and our friend Natalie has asked us about healthcare organizations and what are some of the current guidelines. And Natalie, before I let Sean go into more depth on this, I will tell you that the healthcare guidelines are an interesting web, and there are multiple laws and regulations that could apply here. So one thing that we do encourage, if you are a healthcare provider, that you do talk to your legal counsel about this, because it could complicate things if you operate in California, or that you're a healthcare system that operates in multiple states. This kind of thing layers on. But there are multiple laws that could apply to healthcare systems. And Sean, would you like to go into more depth about that?
Yeah, I would like to address Natalie's question really at the high level, like you were saying in some ways here, Reagan, to make it interesting, because a healthcare organization, there could be a lot of healthcare organizations, right? Insurance companies, platform providers, hospitals. And there is variability there. That, and they're all under various pressures. What I will say is, one of the recent conversations we have, for instance, are telehealth platforms. We just talked about, chat platforms, Teams and Zoom and WebEx and those types of things. Telehealth platforms, as Reagan mentioned earlier on, have gone from novelty to all of a sudden necessity. And there's questions on their level of accessibility as well. And now they're realizing that they are an essential service. So there's a lot that is in play there, because if you are, for instance, a insurance company, well, okay, so now you have your normal healthcare websites and portals and access to information you have to be concerned about for level of accessibility, and then also your telehealth platforms and things of the like. And even to the extent if you have a lot of employees, internal systems as well, and many of those insurance companies in the tens of thousands of employees range do actually have to consider it. The kind of upside as a healthcare organization you can look towards are ones that everyone can certainly look towards, but certainly at a time like now, better customer service, more efficiency, obviously less compliance risk, and ultimately capturing more customers. We've seen a lot of innovative healthcare companies, even startups, really kind of explode in COVID-19 and start to do more in this area to help make online health, an actual usable and good reality for people, which has been inspiring, honestly.
And we actually just, and I'd encourage everybody to go to the User First website under U News. We actually yesterday just released something on telehealth and for persons with disabilities. It was a great story, included our folks at the Kessler Foundation, as well as a friend of ours that we consult with who has cerebral palsy. And he provided his aspect on telehealth for persons with disabilities in this atmosphere. We did mention in there things like the Affordable Care Act does apply because it covers online health programs. It's actually talked about in the Affordable Care Act. Section 504, the Rehabilitation Act, may apply because a lot of hospitals, a lot of healthcare systems are recipients of federal financial assistance. So that's where we see the layering on and things like that. So again, just with healthcare, talk to your lawyer too. That's the safest thing to do, is talk to your legal counsel.
Yeah, absolutely. And we, as we mentioned, we have someone in-house, that can address at a high level some things as well here at User First.
So, Sean, we did have someone on the line. I know we had a hockey team on the line here, and I know you're a huge hockey fan.
I am.
And correct me if I'm wrong, but something like their site, because some people might think, well, somebody visually impaired, how are they going to watch a hockey game or watch a sporting game? And it goes back to purchasing of merchandise usually. Is that correct?
There is some of that, but it actually covers the gamut. Even a lot of the major sports leagues and associations, and I know specifically the NHL has a big campaign called Hockey is for Everyone. Someone here at User First actually on Sunday mornings prior to COVID works with the Washington Whalers, a hockey team that is for blind hockey. So
yeah, it's great.
It's been great to see these leagues and associations open up more. And certainly on their web properties, yes, merchandising and the e-commerce sites are certainly tend to have less of a level of web accessibility, but the outreach, it kind of shows also on the front end from even, buying a ticket to the game. And when you look at sports enthusiasts or any other enthusiasts of music, whatever it might be, even back to the Beyonce thing, which was an e-commerce problem, they soak up information on a day-to-day basis, and they do it all from the website, whether it's stats or what have you. And I say that as being someone who soaks up that information sadly misses sports and other entertainment options as much as everyone else. But all of it comes into play. No pun intended on that, but all of it comes into play.
Okay. Does anybody have any further questions? If not, I think we are going to end everybody's late lunch break. And we want to thank you all for participating one more time. We encourage you to follow User First. We're on LinkedIn, Facebook, and Twitter. We put out some fun posts, but we also provide information. Also, visit our website at userfirst.com. There's plenty of information on there under our resources about web accessibility and our services and whatnot. So, and you can always, if you think of questions that you have after this, you can email us. There's Sean's email address, my email address. We also provided you the generic email address to User First and our phone number. And while we're not in the office, we are getting calls, so that's not a problem at all. And
Yeah.
again, we just want to, oh, Sean, did you have something to add?
I did. I just wanted to say a special thanks. You know, we are happy you attended with us today. We do love talking about this stuff more, and we are cognizant of people's time. So I have conversations all day of curiosities, because ultimately there's a lot of misunderstandings in this area of 15 minutes, 5 minutes, 10 minutes, all the way up to an hour. So, you know, we'll be very open about telling you what we know and maybe what we don't know or would need further analysis. But we're more than happy, and we're glad you joined us today. And I just wanted to say thanks on my end.
Yep. Thank you very much, everyone. Again, have a wonderful day, and be safe and stay healthy.